All right, if we can all convene. Thank you all for coming. It's great to have you all here. For those I don't know, I'm Sandro Galea. I have the privilege of serving as Dean of School of Public Health at Boston University. And welcome to our first Public Health Forum of the calendar year 2019, both people in person and people online. This is the premier academic discussion that we have at the school. We have Public Health Fora once a month, and we try to bring together to our community thought leaders in particular areas who can really help us engage with issues that matter a lot to us as a school. Today, we're delighted to have a talk about homelessness. I'll introduce the speaker in a second, which is co-sponsored by our partner, the Boston University School of Theology. We're very grateful to them for being a part of this, and to Dean Mary Elizabeth Moore, who is here somewhere, who is co-hosting this with us. And for those of you from School of Theology, welcome to our campus. One note about the topic of today for a second about homelessness. It's a particularly apposite day that we actually are doing this Public Health Forum on this today, is that today the medical campus community is also participating in the city's annual homeless census. The census aims to quantify a number of individuals who are living unsheltered in the city, and Dean Cox, who heads up our activist lab, is a core part of the effort that goes into every year into the homeless census. And we're also very pleased that Dr. Jim O'Connell, who is medical director of Healthcare for the Homeless, is also here with us today. So it's a particularly appropriate day to be discussing the topic that we are discussing. And for this topic, we're actually immensely fortunate to have one of the world's leaders on the topic to talk to us about this. We have Dean Hilary Godwin with us today. Dean Godwin joined the University of Washington in July of last year as Dean of the School of Public Health and Professor of Environmental and Occupational Health Sciences. Dean Godwin has had a long, storied career focusing primarily on molecular toxicology of engineered nanomaterials and heavy metal lead. She's also worked in a number of conservation programs, and she has a passion for programs and projects around interdisciplinary collaborations. She comes to the University of Washington from the UCLA Fielding School of Public Health, where she was for many years, and that's how I got to know her, as the Associate Dean for Academic Programs and Professor in Environmental Health Sciences. And while she was at UCLA, Dean Godwin was really one of the national leaders in thinking through about education and about the evolution of education. That has been a really interesting and exciting space in public health for many years. So we are really delighted to have Dean Godwin here with us today. Hilary.
I guess I don't need to stand behind that. Okay, so thank you for that lovely introduction and for the opportunity to be here today. I will start by contradicting you, which is that I'm definitely not a world leader in the area of homelessness and health. And in fact, many people were like, why are you talking about this? Because it's not my area of expertise. And so I thought I would start by telling you a little bit about why I chose this as a topic. So. As Sandro said, I've been at the University of Washington for 6 months and have spent a fair amount of time talking to our partners across the community and asking them what they think we could be doing as a school, both the University of Washington School of Public Health and also as an institution, the University of Washington, to contribute more to helping to solve important public health problems in our community. And as part of that discussion, I usually ask people, what do you think are the most important public health problems that we face as a community? And the number one answer that I get back is homelessness. So that is why I'm here talking to you about homelessness today. I have made it a point in the short time that I've been there to try and get better informed about homelessness within our city and across our nation. And what I'm going to tell you right now what my main point is, but I'll come back to it later. But really have come around to the perspective that in order to create substantive change in this area, that we need to change the minds of the people of the United States. So I really have come around to a perspective of that as we go farther and farther upstream and say what are the things that contribute to homelessness, to me, and our inability to make significant progress in this area, to me, the root cause of it is a lie that we tell ourselves starting from when we're in elementary school and studying US history. And that lie that we perpetrate in this country is this idea that all people have equal opportunity. It's something that We teach our children and we act as though this is the core principle of our country, and it is absolutely untrue. And it has never been true in this country. So, and that has ramifications for all sorts of groups of people who have historical disadvantages that impact their opportunities today. But it also, to me, what compounds those injustices are that because we buy into that lie, we end up adopting a perspective that somehow people who are suffering have brought some component of that upon themselves. And by doing that, we inflict, in my opinion, an additional harm upon people, because then they're left with that suffering and the feeling that they are somehow responsible for harm that is not of their generation, that has been brought upon them by injustices in society instead. And so that's, to me, is sort of the core issue that we're grappling with, that when we talk about how do we combat homelessness, that if we don't get at that core problem, that we will never get our population in the United States on board with providing the funding, social supports, and policies that will allow us to tackle this issue. So, as I said, that's where I'm going to end, but I want to start with it as well and give you a sense of how I came to that perspective. Oh, so I should say, for those of you who have been in Seattle, a significant percentage of the unsheltered homeless within our city live in tents. So this is a very common view that you see, particularly under freeway overpasses, is the site of people living in tent communities. Okay, so how did I get to this perspective? So I want to weave into the discussion about homelessness a personal story of sort of my journey to examining personal privilege, and in particular talk about a friend who was very important in helping me launch into that journey. And that friend is shown over on your right-hand side, Bill Carmaine. So I met Bill through my husband, who's shown over here with me, and my son Jake, when he was much younger. Wow, a long time ago. So Jake was a baby, and now he's 17, so I guess probably about 16, 17 years ago. And I met him through my husband, Pete. Pete met him in a bar, and we were going through a pretty difficult time in our lives. So we had a newborn baby, and I had just been diagnosed with a very aggressive kind of cancer, a sarcoma, and got a really horrible prognosis. So, and this was with an 8-month-old baby. And to compound the sort of, that would be psychologically difficult for us anyway, but to compound the sort of psychological challenges associated with that, both my husband and I had lost younger siblings to cancer. So, and my younger brother had died only 4 years before I had been diagnosed. So for both of us, it sort of reawoke this very real feeling of that life was short and a sense of not having control over that. So, and my husband is a super outgoing person. I often joke that he gets along better with people that he doesn't know. He is literally the kind of person who makes friends in bars. So it was not surprising to me that he met Bill, but it really was a time when I was so focused on getting well myself that it was important for him to have a friend that he could go and spend time with who did not want to talk about, the hospital or hospital bills or prognosis or anything. They'd get together and they'd drink beer and play chess. Slowly, sort of, I got to meet Bill. Bill was an enormously talented carpenter. So we were living in Chicago at the time, and he had a business where he would work renovating, creating new window frames in old houses. So actually building replicas of the original window frames in in 100-year-old houses, which was perfectly suited to his talents. And he lived in what we called there a coach house, which is a little apartment above a garage outside the back of a big, large mansion in Chicago, which probably, when it was originally built, had been built as servants' quarters. And around the time that I met Bill, the person who owned the coach house and the house in front of it sold that house. And so he was asked to move out of the coach house. And although he did work as a carpenter, he didn't have enough money saved up for him to be able to move into a place of his own. And so he and my husband had this agreement. My husband was looking for a property to rent for running his consulting business out of. And so he rented a property that had a little apartment in the back of it, and Bill moved into that apartment. To be honest, I didn't interact with Bill a huge amount for the first couple of years that they were friends. But then Pete asked him to renovate our basement while we were in Chicago, and so I got to know him better then. And then when we decided to move to Los Angeles, Bill was going through a breakup with his girlfriend. He was still living in this apartment in the back of Pete's office. And I remember saying to him, you know what? Why don't you just drive one of our, he was really upset that we were leaving. And at the time, I don't think I really realized us leaving meant that he was losing his home. And I said, why don't you just, drive one of our cars out. Road trip is good for, healing a broken heart. And we're buying a house that needs fixing up, and maybe you can help us fix up the house. And that was the beginning of basically 8 years of Bill living with us and doing amazing work on the house that we lived in and becoming really like a sibling to both Pete and myself. And why do I say this in terms of changing my worldview? Bill came from a very different background than either my husband or I did. We had some things in common. We both grew up in Southern California in the 1970s. But that's where the commonalities ended. So his dad was a casualty of the Vietnam War. My dad was in graduate school in the Vietnam War and got a deferral because he was going to school. And so he was raised by a single mom, and I had the privilege of being raised by a complete family. And that had a big impact in terms of our upbringings and also the financial stability of our households. Bill also lost his mom to cancer when he was 17, and with losing her, lost his entire support system. So he joined the Army at the same time that I headed off to go to college, and was in the Army for a number of years, and then got casual work doing carpentry and welding throughout the rest of his adult life. And it really was through this living in a home together and having just general conversations that I realized it really was the first time that I had a friend who came from a very different socioeconomic background than I did. And talking to him, that I realized he was just as smart as I was, but he didn't go to college because he didn't have that opportunity. And as a result, his path through life was completely different from mine. And his stability and his chances to do different things were completely different. And we also had great conversations about how he hated, that you can't see in this picture, but he had tattoos later on his arms and legs. And people would give him nasty looks and denigrate him for that. He didn't have good teeth, and people would give him grief about that. And it was one of the best friendships that I've had in my life, but also just this amazing openness in terms of being able to have conversations with someone that normally we don't have those kind of conversations. So it really, why did he end up staying with us for 8 years? He was a part of our family, but also we were his safety net. And that was sort of the bottom line. Unfortunately, there's a significant number of people in the United States who don't have that kind of safety net. And as a result, when they come upon situations where they lose their subsidized housing or they lose their low rent housing, they don't have the resources to rent someplace new, and they end up being housing insecure or homeless. And you can see, so this is a map of the rate of homelessness per 10,000 people of the general population across the United States. You can see that there's particular clustering on the West Coast. Anyone who's lived on the West Coast is probably familiar with this. There's another lie that people tell about those trends when you live on the West Coast, which is somehow people think that people are migrating to the West Coast to not be housed because they think, oh, it's because it's warmer here. That is statistically not true. Predominantly the people who are experiencing homelessness in a particular region are from that region and have lived there a long time. The reason that you see that trend, and also up in the Northeast, is because that's where the expensive housing is. So the biggest predictor in terms of whether or not you have a high percentage of people who have housing insecurity is the cost of housing in that area. So so this is Washington State, for those of you who are not familiar with it, my new home. And Seattle is right here, and this is our county, King County. So you hear me talking a lot about Seattle, King County. A lot of our public health services are joint between the city and the county. So we often just call Seattle, King County. As you could see from that map of the United States, we have a particularly high rate, rate of homelessness, which is about 29 homeless per 10,000 people in the general population. So we're one of the higher areas, and King County is by far has the highest percentage across our state. And I just want to emphasize that those numbers that you see represent what Dean Galea was just talking about, which is the count on a single night. And ours is actually, I think, tomorrow. And I was thinking, why would they count on such a cold night? but for whatever reason, this is the night that's chosen. And it vastly underrepresents the number of people who are impacted by housing insecurity. So if you look at, and that's because just because you're experiencing housing insecurity on a particular night doesn't mean that there weren't other people experiencing it on other nights of the year. So if you look at the total number of people across the United States, when you sum up all these counts who experience homelessness each year, it's more like 500,000 people. And that is close to 0.2% of the US population. So it's a significant percentage of the population, and that doesn't even reflect the countless others that have housing insecurity that affects them deeply in terms of their personal lives and their well-being. The other thing that's obscured by just looking at those one-night counts are important factors like what percentage of those individuals are sheltered versus unsheltered. So unsheltered would include individuals, for instance, in tents, like I showed you on the opening slide, people living in their cars. And although being sheltered and housing insecure is not an ideal state, it's definitely worse in terms of health outcomes and emotional well-being to be unsheltered. So we get concerned when we see high rates of unsheltered, and those rates, unfortunately, have been increasing. So this is looking at over time. This is for Washington State. Total number of homeless, you can see that there was some progress being made, and now that we're starting to increase again, and that a large percentage of that increase is due to individuals, but also, to me, really disconcerting is that we're now starting to see this increased number of unaccompanied children and youth popping up as well. So, so it really masks some of the details that are really telling and important. So what do we know about individuals experiencing homelessness in King County in Washington? So in 2017, when we had our point-in-time count, over 11,000 people were identified as experiencing homelessness on that one night. Nearly half of those individuals were unsheltered. We've seen over the last 5 years that the percent of the total homeless population in Washington state, the percent that's unsheltered has been increasing, as has been the number of deaths that are investigated by our county officials. Over half of those individuals reported experiencing at least one disabling condition. And to the point of that these are people who were housed in our communities originally. They are our residents. 77% of the homeless lived in King County before they became homeless. Another 10% are from surrounding counties, and only 9% are from outside of Washington. And furthermore, sometimes people make comments of like, oh, people don't want to move into shelters. 93% of those interviewed said that of the unsheltered respondents said that they would move into affordable housing if it were available. And we are not alone in this struggle. So I'm focusing a lot on details about Seattle, King County, but I just want to point out that in Massachusetts, you have a similar rate of homelessness as well, and it's a lot colder here. Okay, so what has happened in response to this increasing percentage of individuals experiencing homelessness? So starting in November of 2015 in Seattle, King County, a state of emergency for homelessness was declared. The Seattle Times estimates that in 2017, over $200 million was spent addressing the issue of homelessness, and yet the numbers are still increasing. There was a consulting firm, McKinsey & Company, estimated that to appropriately address the issue, at least twice that amount of resources would need to be committed on an annual basis. And yet, when you talk to the people in the different government agencies, I would say there's pretty much a lack of consensus over, given that we only have, let's say, half the money that we need, that how those resources should be spent. And these are people who are all fairly well, much better informed than I am, very well informed about the issue, and have genuine concerns about the distribution of how we spend resources between long-term permanent housing solutions versus how we spend resources to help people who are in acute situations who need temporary shelter. And because we are not committing the kind of resources that we need to cover both of those, we end up with this Sophie's choice of having to choose which area to spend money in. In May of 2018, right before I moved to Seattle, I was super excited because Seattle proposed a really large employer jobs tax. So employers that had over, it was either 500 or 1,000 employees would have this additional tax that they would have to pay that would generate $47 million in annual revenue, which you can see is still not enough. That failed largely due to opposition from the large industries in the area, namely Amazon, who threatened to move to other locations. And just in September of this year, Seattle King County's Board of Health passed a non-binding measure recommending that temporary disaster shelter be provided for all unsheltered homeless within Seattle King County before inclement weather hit. But that was a non-binding measure. They didn't have resources to commit to it or any authority to hold over agencies. And so it really is just a statement of, in support of continuing to spend some of those sparse resources that we have on helping people who are currently affected. So what I wanted to talk about now was, what could we learn from taking a more sort of public health approach? And what does a public health approach to this problem mean? So it means So in public health, we frequently talk about shifting more towards a prevention approach. So I want to talk about what does that mean specifically in the context of homelessness interventions. So this is a diagram, and if you guys haven't seen this article, I highly recommend it. So this is from, I'm sorry, I cut off the top a little bit there. This is from a group from LA County's Homelessness Initiative, which is an amazing group. The lead author is from LA County Department of Public Health, taking sort of an upstream social determinants of health frame and applying it to homelessness and saying, here are the health outcomes, here are the social determinants of health, and what strategies could we use to intervene? And divides it really into primary prevention, secondary prevention, and tertiary prevention. So, and within public health, we always want to shift more towards primary prevention, right? Because we'd like to deal with the problem before it starts. But I'm going to start here by talking about tertiary prevention, which already is a pretty prevention-oriented approach. Okay, so the tertiary prevention approach is what's often referred to as a housing first or housing plus approach. And the concept is providing permanent supportive housing for individuals who are chronically homeless or have some disabling condition. So these are the individuals who are going to have the hardest time getting into permanent non-supported housing. So the idea is that in addition to providing rental subsidies, that you would provide intensive case management and health care and access to a suite of different benefits as well, so that the person has the kind of support system that they need to have their needs holistically addressed. So housing first, the idea is you can't have good health unless you are housed, unless you have permanent housing. But the housing plus is, in addition to that, providing these additional supports. And so that already sounds like a really good idea, right? And so from a public health perspective, we're like, that sounds like a great approach. But I just wanted to point out that as we've seen that approach emphasized and implemented across the country, so permanent supportive housing is shown with the sort of dashed lines going up over time, over roughly the last decade. What's happened is that the resources that have been committed for transitional housing have decreased. And so although, yes, it is fabulous that we're investing in this and it is the right thing to do, it's coming at the expense of other types of social supports that are still absolutely needed. Okay, so what is secondary prevention? Secondary prevention is interventions that are aimed at recently homeless and is often referred to as rapid rehousing. So these are data from Seattle-King County looking at an intervention program focusing on rapid rehousing. And they're consistent with what other programs have seen in other large cities in the United States, which is that a high percentage of the people who are served by these programs transition to permanent housing. So in the case of Seattle, our target is that we're trying to get to 85%, and right now we're at 73%, which is still pretty good, and much better than people who don't have than the rate for people who don't have this intervention. And importantly, also low rates of returning to homelessness. So currently in Seattle-King County, individuals who are participating in this program, less than 5% return to homelessness within 6 months. So those are great outcomes and the kind of things from a public health perspective that we would like to see. From other studies across the nation, including some really key studies in Chicago, people have also shown that rapid rehousing is really important in terms of behavioral outcomes for children. So they fare much better. And also decreased psychological stress for adults. And I think both of those are intuitively obvious that that would be the case. But it's nice to have well-controlled studies that validate that. So those both sound great. They sound like prevention. So what is primary prevention? Primary prevention would be preventing people from becoming homeless in the first place. And that really focuses on this trifecta of providing ample supply of low-cost housing, living wage jobs, and social safety nets, right? You have to have all three of those in order to really make a difference here. And again, studies from Chicago have shown that these are cost-effective interventions. So the cost is about $10,000 per homeless spell that's averted, which is a good investment. However, these are challenging types of programs to implement. And one of the big challenges is that we just don't have the resources, right? So it's an expensive cost because you're targeting a much larger population. And when you start thinking about like, well, how could we narrow down and just target the families who are most at risk, then you run into the problem of how do you identify who's most at risk? How do you decide whom should get these kind of interventions? And obviously, they're the kind of things that we feel, like at least in public health, I think we feel like we should be providing to people in our society as a whole, right? So making a decision of like who should get this intervention, again, comes back to feeling a little bit like a Sophie's choice. And then again, to me, I think another huge barrier to us implementing this is this psychological barrier that we have in this country, which is getting people to believe that this is, in fact, not just the right approach, but it is ethically and morally the correct approach. So I wanted to talk a little bit about some of the other things that are going on that people in our school are working on, also people at UCLA. I know you have great people here that are working on stuff as well, but frequently I hear from students of sort of like, what could I do? And so I want to talk about some of the things beyond just the sort of societal approach that people are doing. So going beyond just sort of this framework of prevention. So one of my favorite people from UCLA is Mike Prelip, who's now chair of community health sciences. Mike helped to launch a program called the UCLA Mobile Clinic. It is a student-run organization. He's been their mentor for years. That goes out and provides essential services to communities in need, particularly individuals experiencing homelessness in downtown LA. And it's just this great group of students who get together. It's pre-meds and medical students and public health students who organize it and figure out what they can do in their own capacities, but a great way for people to actually get out in the community and talk to real people. I don't know whether or not you have something similar here, but it, I think, is a really good model. Something that was championed by Amy Hugopian, who's in the School of Public Health at UW, was this idea of bringing what's called Tent City 3, which I'll tell you a little bit more about in the next slide, to the University of Washington, and they're now trying to bring it back to the University of Washington. So tent cities in Seattle are sanctioned encampments where groups are, again, self-organized and have their own codes of conduct that are enforced by the people who live in those communities. And as a result, they are allowed by the city to stay in locations for up to 3 months. But they're constantly looking for host organizations for where they can go to next. And so a couple of years ago, Amy and a number of other faculty and then students at UW maneuvered to get them to be able to stay at the University of Washington for 3 months. And it really was an unparalleled opportunity for students to really get and faculty to get engaged in the issue. And I have spoken to people from the community who have said they didn't like the fact that the University of Washington has sort of talked about it as this learning opportunity for students. And I agree with that that is not the primary motivation. The primary motivation, in my opinion, is the university walking the walk and actually stepping up to the plate and providing assistance. But I have to tell you, when they did surveys of faculty and students before and after hosting the encampment, people's perspectives on homelessness and the causes of homelessness changed perceptibly. And to me, that is a really important outcome, that people, particularly around this issue that I brought up of people thinking somehow that these individuals had brought this upon themselves, that there was a significant shift in that perspective towards something that I would call a more public health perspective of realizing that there were upstream determinants of health that were not within the control of individuals that impacted their ability to stay permanently housed. So to me, that was a big positive. This is just a picture of one of the sanctioned encampments in the city of Seattle a couple of years ago. And you can see that part of what I was talking about, there's a lot of, this is in particular sanctioned encampment, but you can see how close it is. That's right near our stadiums downtown. This is a very visible issue within Seattle. But again, to me, amazing thing about the sanctioned encampments is the sort of self-governance portion of it. And Amy and her students in the community-oriented public health practice MPH program have done work going out and working with the communities with the sanctioned encampments, talking to them about their governance structures and trying to figure out what parts of that work. And it is a really nice model for respecting the sanctity of the individuals that are experiencing this. Another couple of folks at University of Washington, so Seema Klisafi and Susan Collins have this amazing program called HEART. HEART focuses on, particularly on individuals who are experiencing substance abuse. This is a community that within those experiencing homelessness that is largely underserved. So many of the shelter environments have, including the sanctioned encampments, have absolute prohibitions on substance use. And I feel privileged not to be someone who has issues with that, but I have to tell you, if I was living on the streets, it's easy for me to imagine that that would be a way of coping with the situation. And to say to someone who's addicted to something, you have to stop that in order to get help, to me seems patently ridiculous. So I really applaud them in terms of the approach that they're taking. And then finally, I talked to you a little bit about the Board of Health resolution that was in part driven by Bill Daniel, who is recently emeritus from the Department of Environmental and Occupational Health Sciences at UW, and is now serving on the Board of Health, who was really instrumental in getting that pushed forward. But I think even Bill would say, it still feels like we should be able to do more, right? So, in particular, I think we all felt like this joy of having that resolution passed by the Board of Health, and then this fatalism of like, nothing's necessarily, how is anything going to change as a result of it, right? We didn't have any, there was no enforcement, there was no resources, right? It was the right thing to do, but it's not enough. So I'd like to come back to that sort of, how do we create that larger change that I think is needed to really resolve this issue. So a big part of it is resources. So having moved recently from Los Angeles up to Seattle, I can say what has made a huge difference, and there's still a lot of work to be done, but it's like you can see a way forward, is that Los Angeles passed a proposition that was passed by the voters of the county for a proposition that's called HHH, which is a $1.2 billion bond measure to build new housing for chronically homeless. So again, this is sort of this primarily tertiary prevention approach. Just this fall, we were super excited to see that San Francisco also passed a ballot measure, Proposition C, to raise between $250 and $300 million in corporate taxes annually to fund housing for homeless. And one of the things that contributed to the success in San Francisco was that their big local employers were behind the measure, right? So getting the corporations backing these taxes that are aimed at them is absolutely critical. We keep looking, one of our big employers is Amazon, so we were excited to see that Jeff Bezos announced creation of a $2 billion fund and it's pretty vague at this point what's going to happen with it, but broadly they've said to help homeless and create a network of preschools and low-income communities, but we're still sort of waiting to see what that's going to turn out to be. And then most recently, just in the last couple of weeks, Microsoft announced a pledge of $500 million to fund affordable housing in Washington state, about half of which is going to King County, and the other half is going to the remainder of the state. But I think I probably impressed upon you that, like, even though $500 million sounds great and we're really grateful for it and it's fabulous, it is not enough, right? We need to get the kind of ongoing resources dedicated to this that will create permanent change. So I really feel like we're at a point where we need to change the narrative that we have around homelessness. Something that when I've talked to people and they've said, this is where you could step up to the plate, a frequent narrative that I hear in Seattle is one of, like, we're spending tons of money already and people are wasting the money. There's this weird thing where they call the homeless industrial complex. It's like, I don't even know what that means. It's like that somehow people are convinced that, like, the money's there, we're just not spending it wisely, or we don't know what to do. That's not true. We have really great NGOs that are working on this. We have committed government groups that are working on this. We have people who have done evidence-based interventions and demonstrated what are effective approaches. What we don't have are adequate resources, and we don't have a multi-pronged, effective implementation plan. So I think we're sort of stuck in our community at this point where people are saying they don't want to provide more resources until we have a good plan. And I guess I would turn to our neighbors to the south in Los Angeles and say, we were at the same place in Los Angeles a couple of years ago in 2016 when that proposition came forward. And this seemed like a huge, intractable problem. And people stepped up to the plate, took a leap of faith, and said, let's commit resources to this problem. And with those resources came an amazing mayor who really has phenomenal leadership and has set up this great task force that has come up with a really good plan. And is everything solved now? No, it's not. But this is like the first year where there's hundreds of millions of dollars coming in as a result of this initiative. And they are doing great things. So to me, that is sort of a sign of, like, we cannot wait to commit the resources until we have a plan. Sometimes you need the resources in order to have the wherewithal to come up with the plan. We need to make a step forward. And then I want to come back to where I started, which was sort of this sea change in terms of how do we get people in our country to acknowledge that we have inequities, that there are injustices in our country that affect people. And I look back to, I was reading a book about Seattle during the Great Depression, and there was a picture, this very picture, in that book about Hoovervilles on the Seattle waterfront. And this is actually not all that far from that picture that I showed you of Nicholsville. And I looked at it and I thought, that looks better than the tent encampments that we have right now. And yet, and I wasn't alive during the Great Depression, but my grandparents were. And when I talked to them, I never heard narratives of people saying, oh, well, a lot of people, like, lost their homes in the Great Depression, but, they just weren't working hard enough, or they just weren't willing to do X, Y, and Z. That's not the country's narrative from that time period. This was a horrible period in our country's history, and a lot of people were affected, and it was not their fault. And the country stepped up to the plate and said, what can we do as a nation to help the people of our country? Because that is the role of government. And did things change completely? No, we still have inequities. And there still were, in the decades to come, gross inequities in terms of government subsidies, particularly in the area of housing. But I still come back to we need to somehow get back to this place where we are not blaming the people who are affected, and instead we are working with them, listening to them to create solutions. So how do we do that? And I think some of it comes back to us in public health in terms of how we change the narrative around social determinants of health and health inequities. So I have to tell you, when I talk to non-public health people and I use the phrase social determinants of health, it's like they get this glassed over look in their eyes, right? It means something important to us as a community. It means nothing to everybody else. And it's way too complicated, right? So it's like, it doesn't matter. I've already lost them. I can start explaining what it means to us and why it's important, but they're already like, they aren't listening to me. They're already thinking about what they're making for dinner. And so we need to figure out a better way of talking about this problem. We need to figure out a better way of catalyzing discussions about injustices in our country and the steps to fight those injustices. So I'll come back to my friend Bill. So I said Bill lived with us for 8 years. And was an amazing friend. And he ended up getting cancer. And he was the person who was there for me and my husband when I was dealing with cancer. And I always felt like he saw in me like the hope that he had not seen for his mother, which his mother had died had died young from cancer, and she hadn't had good health care, and so she hadn't gotten treatment. And I was the counter example to that. It was like I had amazing health care, and I got, I had surgery and chemo and radiation, and I'm still here. I miraculously am fine, right? And so for Bill, it was like I sort of embodied that hope for him. So Bill, conversely, did not have health care, right? So he was working odd jobs, living in our house. We loved having him there. He was an important member of our family, but that did not give him health care. And so when he got sick, he did not go to the doctor. He wasted away for months and said, oh, my stomach hurts, I don't feel like eating. And then finally at the point where we're like, what is going on? And said I'm taking you physically to the doctor. He's like, I don't like doctors, don't want to go. And I was like, what about the VA? You were a veteran. Maybe, the VA. He was like, no, I'm not covered. And by the time he got diagnosed, he already had really far advanced stomach cancer. And the doctor who did the CT scan where they diagnosed it, which was literally one of those walk-in clinics down the hill from our house, said to him, you need to get on Medi-Cal. You need to get the state to pay for you to get, so you can get chemo, so you can get this treated. And he was like, I don't even want chemo. But then as he got sicker, he was like, okay, I'll do the chemo. And so he went online. We tried to get him enrolled for Medi-Cal. But he ended up going to the county hospital, and it was an eye-opening experience for me, and honestly, a window into, again, the incredible privilege that I've had in terms of having good health care and benefiting from that good health care. The people at the county hospital were amazing, but by the time he got there, there really was nothing they could do other than palliative care. And he passed away. And about a week after he died, in the mail we got the letter from Medi-Cal saying, hey, you've been approved. So I just say this in terms of he was an amazing person. He had amazing contributions to make to this society. I was proud and happy to have him as a friend. I learned a tremendous amount from him, but I do feel like our society failed him, and for reasons completely beyond his control. So that is where I will end. I did want to thank not only Bill, but my mentors since I've been at University of Washington, Amy Hagopian and Bill Daniel, have spent countless hours with me, tutoring me about what's going on in terms of homelessness in Seattle, King County, trying to bring me up to speed. Any mistakes that I have made or inaccuracies that I have perpetrated are not their fault. They have tried valiantly to bring me up to speed and really been great about explaining when things are just complicated and hard, and there aren't easy solutions. And then I wanted to point out finally, if you haven't read this book by Jo Ensign, which is called Catching Homelessness, she's faculty in our School of Nursing who is a community nurse practitioner who has worked for decades on homelessness and has experienced homelessness herself. This is an amazing book. I highly recommend it. And I thank you all for listening. And don't ask me hard questions, because I'm not an expert. Okay, that's it. Five minutes for questions? Yeah.
I wanted to ask you about the program at UCLA and where the students, and you mentioned certain disciplines. Were the law school, do they have a law school, and was the law school involved?
Yeah. So UCLA does have a law school, and I don't remember whether or not they had significant presence in the mobile clinic or not. So the law school does have a legal clinic that they run, but I'm not sure whether they actually have a program where they're going out to the communities. For those of you who aren't familiar with Los Angeles, UCLA is in a fairly wealthy enclave of Los Angeles, so and not accessible by public transportation. So actually leaving that and going out to the communities that you're trying to reach would be critical. And I just don't know the answer to that. But you're right, it's a really good point.
Hi, thanks so much for your talk today. Is homelessness and other social determinants of health addressed in any areas of the healthcare system, either in the ED or in primary care in your community?
Yeah, so a lot of the people at the University of Washington who work with the people who are experiencing homelessness are at the medical center. It includes and people in nursing as well. But yeah, so I would say the primary group of people who are sort of in the trenches on a daily basis, yes. Yeah.
Thank you. When you go out to do outreach to the homelessness, do you come back? It seems like you have the solution, but the results should be their narrative. Like at the end of their day, you should be asking them at the end of the day, what is it that you want? It's not about me.
Right.
It's at the end of the day, what do you want so I could bring back and we could come up with a solution and come back with the results to give you.
Yep.
So I think maybe if you could put that in your assessment somewhere. And try it that way. At the end, and you know, maybe a lot of them are experiencing, like I'm going through now, ageism.
Yeah.
You know, they can't get a job.
Right.
So at the end of my day, what do I want? I want a job. I don't care what it is.
Right.
But I'm not getting that because of my age. And that's a lie.
Yeah.
You know, that's another lie that society is telling people. You know, after 35, you're no good.
Yeah. Yeah. Yes, you're absolutely right. So I actually do think that the permanent supportive housing is based in feedback from people at least in Seattle. There is good documentation from the counts where they ask people, is this what you want? And the answer was yes. But I agree with you, when you look at the upstream, how do we once we get to the primary prevention, I completely agree with you. Yes, you're absolutely right. Yep.
I was curious because you've seen homelessness in 2 different locations. Do you notice that there's like a difference in the culture in both these different environments than per se the general United States population in terms of attitudes of homelessness and the unity in the homeless community? Like, do you notice that there's differences in those, like in Los Angeles and in Seattle, Washington? Do you notice that there's a different kind of mentality? And is there a reason why those communities are getting more empowerment? I'm not saying they are empowered, but they're being more empowered than in other areas?
Yeah, so I mean, certainly going from Los Angeles to Seattle, the sanctioned encampments in Seattle to me was something that was completely new. And the strong commitment to the groups living in those encampments having self-governance and defining the rules for their communities and self-governing, to me is an amazing, like you said, it's not completely empowered, but it's much more so than what I had seen in Los Angeles, and I think a great model. It's a really small percentage of the individuals who are experiencing homelessness, though, in Seattle, who are within those communities. So to me, that's a great example of something like, it's great. On the other hand, those are people who are living under pretty dire conditions nonetheless.
And
Yeah.
I was just curious. Okay, so I'm from the Orange County, and we're having a big problem with homelessness right now. How, like, because you were talking about the clash between businesses and homelessness. There have been many arguments that have been made in, like, the city of Santa Ana that homelessness and having these camps takes away from businesses because now people don't feel comfortable. How would you go about addressing that kind of issue? And then I'm done with my questions.
Yeah. Yeah. So I grew up in Orange County as well. And so perhaps I am biased by my experience of growing up in Orange County. But to me, a large part of the issue in Orange County is the issue that I brought up at the beginning, which is people adhering to this myth that they're doing well because they have done something meritorious or they deserve it, and the people who are not doing well somehow have brought this upon themselves. I felt that myth very strongly growing up in Orange County, and one of my sets of parents still live there, and I believe it is still strong there. That is where I would start with Orange County. As like, that is what I mean by fundamentally, when you go far enough upstream, that is what is keeping Orange County and other regions from making progress, is the unwillingness to accept that this is a social responsibility. This is our collective responsibility. Yeah.
In Massachusetts, the legislature put a statute on the books that prevented the municipalities from increasing taxes beyond a certain limit without the approval of the residents in a vote in an election to allow these things. They call it an override. And the advocates of such overrides often phrase it in terms of how much your property taxes will increase if you approve this override. So I noticed that you nominally, it looks like on one of your slides, you have $160 million, and you need twice that amount to do what you need to do. If
that's not my estimate, that's McKinsey's estimate, but yeah.
Do you happen to know quantitatively, if the taxpayers had to foot the bill for $160 million extra dollars, how much taxes on the average house would increase?
Yeah, so, so we have 700,000 people in the city of Seattle. So it would be a hefty burden. And that's why the initiative in Seattle was actually not going to the taxpayers. It was going to the large employers. The argument being that those large employers have benefited tremendously from the growth of the city, and in many ways have contributed to the housing crisis by creating high demand for housing. But that being said, I would point to, I guess, well, so San Francisco, same thing. It was a large employer tax. And in Los Angeles, it was a bond measure. So I agree with you. I think probably, going to individual taxpayers is probably a non-starter in most regions. But I do think that we have seen examples of communities that have figured out ways to raise the kind of resources that are needed. So I would just say we need to work on it.
In our community, we often talk about, for Dean Godwin's benefit, about the importance of changing conversation in public about health, and to do so by combining narrative with data. And it's really rare, though, for us to actually hear a talk like this one, which combines narrative, some of it personal, some of it not, with data as well as this. So please join me in thanking Dean Godwin for a really terrific talk. You can join us. We'll have a bit of a reception where Dean Godwin will answer questions one-on-one now. Thank you.